Hi, my name is Shalini and I am a part of the class of 2023 at the Morsani College of Medicine, and I'm also a general volunteer for the contraCOVID project.
And my name is Richa Bisht. I'm also part of the class of 2023 at Morsani, and I am the Florida State Leader for contraCOVID.
So today we're going to be talking a little more about contraCOVID and its goals and efforts. And so to get started, Richa, would you be able to tell us a little bit more of what contraCOVID is?
Absolutely. So in my opinion, contraCOVID is a national collaboration between future health professionals that was started by Harvard medical students. And it currently includes medical students, undergraduates, and Masters of Public Health interns. And I think our main goal really is to help underserved communities, particularly non-English speaking, Latinx, and immigrant families access the social services available to them in their city. So we've done this by recruiting students from different cities who then compile resources available in their communities into these very comprehensive documents that we then share with community partners and medical professionals so that people who need help can access it.
And yeah, I think it's a really cool collaboration to be able to see students from all across the country coming together to be able to put this together and really help their community. So I think it's really amazing.
Definitely, thank you. And thank you for being part of it, Shalini.
Oh,
so
yeah.
I want to ask you a question as well. How do you think this project has shaped your perspective about the effects of COVID-19 in our communities?
I think it's really opened my eyes to the diverse area of need that oftentimes we don't get to see, and that's oftentimes hidden. Things like food insecurity, losses of jobs, inability to access healthcare, more obvious things, but there are other elements that COVID-19 has affected in terms of community development and things like that. So I think this project has really opened my eyes to how many resources are really available out there. But in many ways, a lot of us, including myself, didn't know just how many resources there are or how to access those resources. And so I think this project and with all the students coming together to put these resources in a really organized list and easy accessibility was really impactful and it allows these communities to have access to resources in a way that I think wouldn't have been available before. And like I said, I think in a lot of ways, these communities don't have that direct access to a list of all of the resources from food insecurity to being able to access employment opportunities. And so I think in that way, this was really eye-opening.
Yeah, definitely. And kind of going off of what you said, I think this project has really highlighted the need for all of us to come together to solve this issue because COVID-19, as we've seen, isn't just a health issue. It can't just be solved by medicine. It really requires financial and social and even emotional support and relief. So I think, yeah, to echo what you said, it's been really eye-opening to see just how much is available in our community that people can access and take advantage of.
Mm-hmm. And to get an additional question in, how would you say this project has impacted you, or what has been the most impactful part of contraCOVID for you, Richa?
Sure. So I think for me, the most impactful part of this project has really been all of the connections I've been able to make. Mm-hmm. So I've been really lucky and I've been able to work with and learn from some really incredible students at University of Miami, Harvard, MIT, and University of Florida, to name a few. Mm-hmm. And I've also been able to collaborate with Masters of Public Health students at New York University and Benedictine University. Mm-hmm. So it feels really good to be able to know that there are so many passionate, dedicated, and truly kind students who will one day be my colleagues in the medical field, mm-hmm. and with whom I have the honor of taking care of patients. Mm-hmm. Also, I think through the process of disseminating the Tampa Resource Guide, I've had the chance to interact with community mm-hmm. partners a little bit more and hopefully serve their needs in the best way that we can. So that's been really satisfying.
That's awesome. Yeah, because I feel like for me, it's been so inspiring, especially like you said, to see how many passionate students there are involved in this project. And it really gives me hope for how medicine will be practiced and continue to be practiced in the future in terms of, providing resources to communities in need and things like that. So I think that's been really awesome.
Right. So along those lines, how do you think being part of contraCOVID has changed the way you might practice medicine in the future?
I think in a lot of ways it's made me recognize how we need to focus not just on the health component of the patient, but also what other needs or issues they might be facing outside of what we see in the healthcare field. So whether it be food insecurity, whether it be financial instability or a need for assistance, or aspects such as transportation where they might not be able to get access to medications or treatments that we might provide them in the future. So I think this project has made me realize how important it is to consider, like you said, the social, the emotional components to our patients' lives and not just focus on the health aspect. And it's also taught me that we can act as a source of resources for these patients, for these communities as well. So I think in a lot of ways we can help guide our patients in the future towards what they might need to help them, not only in their healthcare elements, but in other needs as well.
Yep. Totally agree. Thank you so much for talking with me about contraCOVID today. I think this has been a really fun project to work with you on, and hopefully, we can continue to work on contraCOVID as long as we need to.
Absolutely. Absolutely. Thank you again for talking with me today too.
Yes.